here. My formal name is Dr. Heather Zwickey. I have a PhD in immunology and microbiology from the University of Colorado Health Sciences Center in Denver. And I did a postdoctoral fellowship and taught medical school at Yale University School of Medicine before being recruited to NUNM back in the year 2002 to launch our research institute. So I launched our research institute called the Health Got Research Institute, and then I launched our School of Graduate Studies, and I am currently serving as the provost, the vice president of research and academic excellence at NUNM. I work very closely with the admissions team, and you'll see my name on some of the emails and your letters of acceptance if you are accepted to NUNM. But one of the things that I've done over the many years of my career is I have worked with admissions teams at University of Colorado, at Yale University School of Medicine, at Oregon Health and Science University, and at NUNM. And so I have a little bit of insight that other people don't have typically when they're thinking about medical school. So I thought that I would share some of that insight with you today. So the talk that I'm giving is Alternative Careers in Natural Medicine. What do the MD, DO, ND, DC, NP, and DAcHM mean? But let's just start with some basic stats. Roughly 40% of students will be accepted into one of their top 5 medical school choices this year. However, if you are a first-year applicant, roughly 10% are accepted the first time they apply to an MD medical school. And the top reasons for rejection include a low GPA. At most conventional medical schools, a low GPA is anything lower than 3.4, or a low MCAT score, which translates to under 500, lack of clinical experience. And by clinical experience, most medical schools are looking for some sort of shadowing or volunteering that you've done in a medical facility, either a hospital or a long-term care facility. Working with elderly, working with kids with autism, some sort of medical experience that you've had. Lack of research is another reason for rejection. Now, that's for some of the highly competitive medical schools. They're really looking that you've had some sort of research experience, either as an undergraduate or that you worked in research in between your undergrad and your medical application. And then lastly is an unconvincing personal statement. A lot of times students in their personal statement write about their own medical issues, and that's really not what medical school is looking for. If you want to write better personal statements, we have a different seminar that we run on how to write better medical school applications, and I would encourage you to go ahead and do that seminar. So what if you are one of the 90% that gets rejected to medical school the first time around? Well, the standard paths that the vast majority of students take is they try to retake some courses to improve their GPA, they retake the MCAT, they volunteer, and they often get a job. Work in research is most preferable, but it's really hard to get into those jobs. There's not a lot of those jobs available. So a lot of people just get a job. And unfortunately, a job is not really going to help you get into medical school. Some alternatives that a lot of students don't think about is getting a master's degree. Most master's degrees are 2 years long. There are some accelerated programs that are 1 year, but a master's degree can often help you get into medical school. So master's in public health is by far the most common degree that people who are looking to go to medical school pursue. But there are degrees that are actually more competitive than an MPH. A master's of clinical research is actually a highly competitive degree because you get research experience and clinical experience simultaneously. Often you're seeing study participants in a master's of clinical research program, and that ability to see patients and help them through a protocol is something that is going to help you as a physician. A master's of nutrition is another master's degree that has a skill set that you can use as a doctor. Remember that the average medical school has less than 15 hours of nutrition education. And in fact, when I taught at Yale, they got a total of 1 hour of nutrition. They've currently upped it to 3 hours, but 3 hours of nutrition doesn't allow you to do much with nutrition as a physician. So, getting a master's of nutrition so that you understand nutrition when you're pursuing your medical degree is another thing that makes you more competitive and gives you a skill set that you can use as a doctor. And then a master's of global health is another thing to consider. In a master's of global health, you get volunteer experience, you can raise your GPA, and you travel and see a lot of other medical systems, which again, very valuable if you're thinking about a career in medicine. At NUNM, we offer three master's degrees. We offer a master's of clinical research, 100% online. So, again, this is something that you can do from anywhere in the world. We have a master's of nutrition that is either online or on ground. And there's two tracks within that program. You can either do a clinical track or a culinary track. The culinary track is more food based. The clinical track is more thinking about having a practice in nutrition. And there's a master's of global health that again is 100% online. The online degrees have that advantage that you can do them. You don't have to move anywhere to do these degrees. There's no GRE required, which is the graduate record exam, which is often required for an MPH. There's also no MCAT required. It can raise your GPA. And if you decide to stay in one of these careers, it actually increases your earning potential. If you look at the Bureau of Labor Statistics, those who get a master's degree often increase their earning potential by 20% or more. The Masters of Nutrition, they're estimating 39% increase in earning potential. So master's degrees may also help your earning potential. And if you're looking to go to conventional medical school, it demonstrates that you're ready for graduate level education. Now, here's the typical pre-med path. So first is they apply to medical school and somewhere between 5 and 10% get accepted the first time that they apply. Now, if you're not accepted the first time, as I mentioned, many get work experience and reapply, but that doesn't tend to increase the likelihood that you're going to get into medical school. It only increases it to 10 to 15%. On the other hand, if you earn a master's degree and reapply, now you're looking at a 40% acceptance rate. And then for those who never get into medical school, they may find a career in a peripheral field like medical research, healthcare management, physician's assistant, pharmaceutical sales, or health coaching. Of these particular careers, the most pay you're going to get, in fact, the most pay you'll get ever in the medical field as a pharmaceutical salesperson. I had a colleague who went with me to graduate school who went into pharmaceutical sales and within 5 years was making over $600,000 a year selling Cialis and Celebrex. So you can think about if you're really into it for the money, then pharmaceutical sales is the direction to go. If you're really into it for helping people get better with their health, then health coaching might be a better plan. But MD isn't the only degree in which you can do medicine. All of these are primary medical degrees. And I realized somewhere along the way that the vast majority of people have no idea what all of these other letters are. So we've got MD for medical doctor. DO is a doctor of osteopathic medicine. ND is naturopathic doctor. DC is doctor of chiropractic medicine. NP is nurse practitioner. And then there's the mouthful, DAcCHM, which is a doctor of acupuncture and Chinese herbal medicine. How these degrees differ is primarily in their scope of practice. So if you look at the scope of practice, What we most are aware of is the MD, the doctor of medicine. And in terms of the scope of practice, this is a full medical license. Most MDs are going to be able to diagnose, treat, prescribe, perform surgery, admit to hospitals, deliver babies, and then specialize. A doctor of osteopathic medicine is very similar in that they diagnose, treat, prescribe, perform surgery, and specialize, but they're also trained in osteopathic manipulative treatment, which is similar to chiropractic treatment. It means physical medicine. A nurse practitioner diagnoses, treats, prescribes medications, and also can manage care independently or under MD supervision, depending on the state. And a naturopathic doctor, a doctor of naturopathic medicine, diagnoses, treats, prescribes most medications, but it varies heavily by state, focuses on natural therapies, nutrition, herbal medicine, minor procedures, delivering babies with a midwifery specialty. The big thing to remember with naturopathic medicine is it's only licensed in about 26 states plus Puerto Rico. And the scope is a little bit narrower than an MDDO in terms of surgery or hospital. Okay, so surgery or hospital, it's narrower. But if we actually look at the scope of practice and we break it down into what primarily is being done by each medical profession, we see that MDs are primarily doing primary care, pharmacy, and surgery. DOs have that primary care, pharmacy, and surgery, but they also have physical medicine. What we see with NDs is primary care, and this is really where a lot of our family practice has now started to reside. But we are not using the same sorts of therapies in that there's primarily nutrition, herbal medicine, mind body medicine, physical medicine, hydrotherapy. And then the pharmacy scope is a little bit more narrow than the pharmacy scope for an MD or a DO. A naturopathic physician can prescribe any pharmaceutical that has its roots in herbal medicine, which amounts to quite a few pharmaceuticals. Roughly, it used to be 90%. It's down to about 70% of pharmaceuticals. Anything that is synthetic or antipsychotic is not in the scope of an ND. If we look at a nurse practitioner, they're also doing primary care. Primary care, by the way, which all three of the previous disciplines can do, means that you're the patient's primary care physician. You're referring them out when they need to see a specialist. You're their home care. And all of these physicians can do primary care. So MD, DO, ND, NP, and in some states, actually a doctor of acupuncture and Chinese herbal medicine can also do primary care. The only one that can't do primary care is actually a doctor of chiropractic medicine. The doctor of chiropractic medicine is going to be more focused on physical medicine diagnosis and treatment. Our doctorate of acupuncture and Chinese herbal medicine focuses on acupuncture, Chinese herbal medicine, and then Asian body work, Tuina, Shiatsu, cupping. They also do some nutrition, not nearly as much as a naturopathic physician, but you'll notice that nutrition is not in the scope of care of any of the other medical types other than naturopathic medicine. There's also a difference in all of these degrees in terms of where people work, where do you go to work every day? MDs and DOs are primarily in a hospital or private practice, and the vast majority, 90%, are in hospitals. 10% roughly are in private practice. Nurse practitioners, it's about 50-50. 50% are in the hospital, 50% are in private practice. Naturopathic doctors are primarily 90% are in private practice. Very few work in hospitals, although some do. It really depends on the licensure within the state and whether or not the NDs have done residency. Chiropractors and doctors of acupuncture and Chinese herbal medicine are primarily in private practice. We do see that some Acupuncturists are now working in hospitals. There are some progressive hospitals out there, including the Mayo Clinic and the Cleveland Clinic, who are our top tier clinical centers in the United States, that now have acupuncturists and Chinese herbal medicine practitioners in their hospital settings. We're also starting to see acupuncture show up in the emergency rooms, which is a really good place for it. So, as we look at these things, we see that where people work is very different. We also see that only MDs and DOs require an MCAT. The other degrees do not require an MCAT. So if you're one of those people who does poorly on standardized exams, you may want to choose a degree that does not require an MCAT. And there are several of them that allow you to be in medicine and not require that you can pass a standardized test. One of the big arguments that we hear is that natural medicine is not evidence-based. So I'll just pose the question here of, is it evidence-based? And let's start by looking at an MD, a doctor of osteopathic medicine, and a nurse practitioner. About 10 to 20% of the day-to-day medical practice is directly based on high-quality randomized controlled trials. Is it evidence-based if 10 to 20% is based off of RCTs? I don't know. This is where you have to judge for yourself. About 50 to 60% of clinical practice is based off of some form of evidence, which might include lower quality studies, observational data, cohort studies. And then the remaining 30 to 40% is based off of expert opinion, tradition, consensus, clinical experience, or educated guesswork. What is it for the natural medicine practitioners? So for naturopathic doctor, doctor of chiropractic medicine, and doctor of acupuncture and Chinese herbal medicine, it's 10 to 15% of the practice that is strongly evidence-based, supported by high quality randomized controlled trials. Hold on, what was that again for MDs? 10 to 20%. For NDs, 10 to 15%. It's very similar, very similar. So when people make the argument that something is not evidence-based, it doesn't work anymore. Might have worked 25 years ago, doesn't work anymore. Again, just like with the MDs, 30 to 40% is based on some evidence, lower quality studies, case reports, observational data. And 40% or more relies on traditional knowledge, expert opinion, clinical expertise, biologically plausible theories. These are not considered strong scientific evidence. And where we're really seeing a lot of this is within Chinese medicine. Remember that Chinese medicine has a 2,000, 3,000 year history. And so when we say that a lot of it is coming from traditional knowledge, a lot of this is stuff that's been passed down from generation to generation. What does that evidence look like? I just wanted to show you the evidence base here because nutrition has 70,887 high quality studies. And this is as of this morning. High quality studies, meaning high quality RCTs, clinical trials, systematic reviews, and meta analyses. Botanical medicine, it's 16,000. Meditation, 2,000. Hydrotherapy, 2,000. Physical medicine, 50,999. Almost 51,000. So I guess my question is, when we start talking about evidence-based medicine, how many studies do you need to trust a therapy? Is it 100? Is it 1,000? Because the evidence base is getting really, really strong for these things. Now, in comparison, surgery has 300,000 studies, and pharmacy has 500,000 studies. So there are more in surgery and pharmacy. However, there are 70,000 studies of nutrition. I mean, that's quite a few, in my humble opinion, as a researcher. So I'm going to switch a little bit here, and we're going to talk about what we offer at NUNM. We are the oldest naturopathic school in the United States. All of the other naturopathic schools derive their curriculum from NUNM. So we're the leader in natural medicine education and research. We're the only naturopathic medical school who has NIH grants, and we have many NIH grants. We have training programs. We have um, everything rooted in natural philosophy of multiple cultures, and we have a large alumni base. Now, you may look at that 3,500 and go, that's not a very big alumni base. But remember, we only accept a certain number of medical schools per year, medical students per year. And there are only, 5 naturopathic medical schools in the United States. So our number of alumni is much lower than you would see in an MD or DO population. We're based on the naturopathic medical principles of first do no harm. All medicine is based off of first do no harm. But you have to remember that first do no harm means we don't want to give you a medication that may solve one problem but harm another system. I've just had a recent experience with this with my stepfather. He's 84 and he was at the Mayo Clinic last week. I'm originally from Minnesota, and he was supposed to have cardiac surgery. But when they did the CT scan, they discovered that large chunks of his lungs were missing. And it turns out a medication that they had given him for Crohn's disease that he's been taking for decades now has eaten away at his lungs. Therefore, he cannot have cardiac surgery because he no longer has effective lungs where he can have anesthesiology. So, in a first do no harm situation, we would be highly unlikely to recommend a medication that's going to eat chunks of your lungs to treat your Crohn's disease. We would want to say we do no harm at all. The healing power of nature, a lot of times people think this is about using plants to heal, but it's not. The healing power of nature is this idea that our body has an innate ability to heal itself. And often that is the immune system. So, me as an immunologist, I'm heavily drawn to natural medicine because many natural therapies actually have very strong effects on your immune system. Identify and treat the cause, again, seems kind of obvious, except it's not something we traditionally do in conventional medicine. In conventional medicine, we often medicate a symptom as opposed to treat the cause. So you might think of multiple people who have headaches. I might have a headache because I've been in lots of car accidents. You might have a headache because you're dehydrated. Nicole might have a headache because she's sensitive to eggs and she got egg in one of the foods that she was eating. So if we identify and treat the cause, our cause would not be give somebody an aspirin because nobody's headache was caused by an aspirin deficiency. It was caused for some other reason. And the symptoms will go away if you treat the cause as opposed to medicate the symptom. In terms of treating the whole person, this is the example that somebody comes in with a chief complaint, but they may have many other things that are going on in their body. And the goal is not to just treat the one thing, it's to treat the whole person and everything that's happening in that person. Doctor as teacher is the idea that your job as a physician is to teach your patient how to take care of their own body. It's not to be the person's caretaker, it's to be the person who educates them as to what they can do to help their body heal. And then ideally, we would all like to prevent severe disease, but most of medicine is not about prevention. In fact, I had a physician tell me once that the only type of medicine that truly does prevention is a dentist, because you go to the dentist every 6 months, whether there's anything wrong with your teeth or not. You just go for your checkup to have your teeth cleaned. That's preventative medicine. We rarely use preventative medicine these days. Most people don't go to the doctor unless they're really, really sick. And unfortunately, if you go when you're really, really sick, it's too late for us to prevent the long-term consequences. So we're really working at catching people earlier in their illness so that we can reverse autoimmune disease, reverse diabetes, that we don't have to live with these diseases for the rest of our lives. The therapeutic order is the other thing that drew me to natural medicine. And the reason therapeutic order did that is it's this idea that you start with the least force. So if you can heal someone by just changing their mind or their mindset, you start there. If you have to move on and change diet or exercise, well, then let's go ahead and do that. If we have to go a little bit higher and maybe we have to add some herbs, okay, we can do that. Maybe we need a physical adjustment or a massage. Okay. And then if none of those things are working, that's when we engage pharmaceutical medicine and finally surgery. So the therapeutic order looks like this, where we establish the foundation for optimal health. We stimulate the self healing mechanisms. Then we restore weakened systems, and we might need to add some herbs here. We need to get that physical alignment set up appropriately. Natural symptom control. So again, here's some of our herbal medicines that we might be using as a supplement, so it might be highly concentrated. And then synthetic symptom release. So here's where we get to our pharmacy and finally surgery. But we don't start with surgery. And that's one of the big differences between an MD and a naturopathic physician is where do you start? Do you start with pharmaceuticals and surgery, or do you start lower on the scale? So there's a big philosophical difference here. And if you're not comfortable starting with nutrition and exercise and herbal medicine, then this isn't the right career for you. If really what you think you want to do is surgery, then you should be pursuing an MD. The program overview for a naturopathic physician is that there's primarily we see students join a 4-year track, but if you want to take things a little slower, maybe you have a family or children at home, 5-year track is possible as well. Your end goal is primary care physician. Like all medical schools, the education is experiential. You're doing anatomy and physiology, and you're physically got your hands on patients. You start with your classmates and then you move to patients themselves. As I mentioned, there's no MCAT required. We also have an option for doing the first year online. If you do the first year online, you come in to Portland the summer after your first year, and that's when you do all your labs, because it's not possible to learn how to draw blood online. It's also not possible to learn palpation or do anatomy and physiology online. So all of those labs classes are done as intensives over the summer before your second year, if you do that first year online option. And then you get a lot of clinical experience. And in fact, our clinic is currently called the Lair Hill Teaching Clinic, where our students cultivate their real world clinical skills beginning in their first year with observation. And then in their second year, you'll see down below here, there's hydrotherapy rotations. Third year, you serve as a secondary, you're paired with a primary, and you do the intake for the patient, you do diagnosis, you do treatment delivery. What you're doing is you're seeing patients together in pairs. Then you go into a conference room with a faculty member and you discuss what you think the diagnosis is, what you want to do for that patient, what the alternative therapies might be, and why. And then you, the primary and the secondary, go back into the room and deliver the intervention to the patient. So you have a lot of clinical experience by the time you graduate. There's also dual degree options and certificate options. So any of our programs can be done in pairs with each other. So you can do nutrition with a naturopathic degree, or Chinese medicine and acupuncture with a naturopathic degree, clinical research, global health together. There's also certificate options. A lot of people want to deliver babies, and one of our more popular certificates is in natural childbirth and midwifery. And there's also a homeopathy certificate. And then naturopathic physicians can specialize. Typically, you don't specialize as a student. You specialize once you're in clinical practice. The specialties that are available in naturopathic medicine include oncology, gastroenterology, psychiatric, pediatric, naturopathic midwives, environmental medicine, endocrinology, and generative medicine is the latest specialty. And I wrote out what it is because I think a lot of people have never heard of generative medicine. But this is the idea of restoring or replacing damaged tissue or diseased cells. It includes things like prolotherapy, and stem cell therapy, and naturopathic physicians can do those types of therapies. And they're also very lucrative therapies, if that's something that is interesting to you. As I mentioned earlier, licensure is a thing with naturopathic medicine. Remember that all of medicine is licensed state by state. And in naturopathic medicine, we have different levels of licensure depending on the state you live in. So the most licensure here is the very light teal colors like Washington, Oregon, Montana, Utah, Arizona, Colorado, Maine, New Hampshire, Vermont, Connecticut. All of those have the most licensure. Next most licensure is the darker teal colors. So California, Idaho, New Mexico, Kansas, Minnesota, Wisconsin, Pennsylvania. Our next level of licensure is states that are going for licensure but have not been licensed yet. And that's dark blue here. So Wyoming, Texas, Oklahoma, Arkansas, Mississippi, Georgia, Florida. Florida used to have licensure and lost its licensure, and now they're going for licensure again. Tennessee, North Carolina, Virginia, New Jersey, all of those are going for licensure. And then gray, there is no movement towards licensure currently. In order to get licensed, you have to pass the state exam. And the state exam is called NPLEX. I can never remember what it stands for. Naturopathic licensure exam. I think that's what it is. So you take your basic science boards after your second year, and then you take your clinical boards after your fourth year. Very similar to a conventional MD or a DO, Doctor of Osteopathic Medicine. All of them take basic science boards and then clinical boards. If you're looking at Chinese medicine, it's just clinical boards. If you're looking at chiropractic medicine, it's just clinical boards. Nurse practitioner is clinical boards and basic science boards, like the others. We host ND Exploration Days, and our next one is May 9th, which is next Friday. They include a didactic portion where you're sitting in on classes. There's an experiential component where people are going to herb lab. They might do an herb walk and identify the herbs that are medicinal. They might do ultrasound, lots of different things. It's very social. You get to meet current and prospective students and our faculty. And it's delicious because we serve nutritious organic lunches with all of the various eliminations as needed. So wheat-free, dairy-free, meat-free for those who need those. I just wanted to remind everyone that the vast majority of pharmaceuticals do come from herbs. And so herbal medicine as a source of medicine is not out of the question here. If we think about where the top 10 drugs that come from herbs come from, we see many things that we recognize, right? Not that I necessarily would call cocaine one of the top 10 drugs, but top 10 in terms of use. So there we go. Artemisia is typically used for malaria, but Artemisia is now being used for high blood sugar as well. In fact, we have a clinical trial happening on Artemisia right now. So I guess my other question is, do you know your herbs? Do you know that mint is highly antiviral, and it's the entire mint family? So we're talking basil and oregano and lemon balm and self-heal. All of the mint family is antiviral and works against flu and COVID and rhinovirus and all of those things. You also have all of your herbs that are lowering blood sugar. So cinnamon and artemisia, ginger. We have the herbs that are really good for cardiovascular disease, like hibiscus. Lots and lots of different herbal medicines are working for things that are issues today. And it's one of those basic things that you will learn as a naturopathic student. And now we're going to move on to Chinese medicine, because this is another discipline that a lot of people don't consider because they just don't know anything about it. So, the philosophy in Chinese medicine is that disease is imbalance, that when you are suffering from some sort of symptom, it's because your body is not in balance. And the role of the healer is to help facilitate bringing things back in balance. Very different philosophy than conventional medicine. Diagnosis happens through tongue and pulse diagnosis. It's not through symptoms. The therapeutic modalities are primarily acupuncture and Chinese herbal medicine, but there's also Qigong, there's massage therapy, and there's nutrition. So lots of different things that can be done with Chinese medicine. The reason the yin and yang symbol is the symbol for Chinese medicine is it's a symbol of balance. And so when we're looking for balance, we're really looking at yin and yang here. Now, I told you that we do tongue and pulse diagnosis in Chinese medicine. So what I'm showing you here are a bunch of tongues. And what I traditionally have students do is get your cell phone out and take a picture of your tongue. Okay, so grab your cell phone. Some of you are already on your cell phone. Take a picture of your tongue. So, stick your tongue out and see what does your tongue look like. And what's really cool is that over 2,000 years, the Chinese started documenting all these different tongue pictures. And they could tell you a lot about your own health just by what your tongue looks like and what your pulse feels like. So my tongue currently is kind of like this one. See, it's white in the middle and it's red around the outside. And I am feeling cold easily right now. My complexion is pale, but also a little bit red. Back pain, oh heck yeah. I tried to use a tiller on my garden yesterday, and that was a workout. This was a garden that had not previously been tilled, and I'm experiencing some serious back pain today. I don't tend to panic, but this is definitely where I'm at today. Other days you'll catch me and I'm here. I'm in yin deficiency, and that is because I am perimenopausal. And so I do have hot flashes and night sweats, and sometimes I don't sleep. But last night I slept really well because I got a really good workout with that tiller yesterday. So my tongue does not look bright red today, but it's interesting to me to think that we have thousands of years documenting what's going on with people's tongues, telling us how well they are. So we may not have a clinical trial, but thousands of years of evidence, pretty darn good. Now, the program overview for a Chinese medicine degree is that there is a doctorate of acupuncture, there's a doctorate of acupuncture and herbal medicine. So you can choose to do Chinese medicine without herbal medicine or with herbal medicine, unless you live in California. California requires herbal medicine if you're going to learn Chinese medicine. The program is 4 years. Again, you can do it in 5, or you can do it as a dual degree with the ND degree, and that's a 6-year degree. And then you're doctor, your doctor of naturopathic medicine, doctor of Chinese medicine. Again, the education is experiential. What I'm showing you here is a bunch of our students doing Qigong in China with 2 of our faculty in a Buddhist retreat center. So a lot of opportunities to study abroad in all of our programs, not just in global health. The other thing about Chinese medicine that I think is really interesting, and again, this is not well studied, but this is documented over thousands of years, is the Chinese have mapped when each organ system is at its peak. And so if you go through, you'll see that there are different times of the day that different organ systems are highly functional. The way that I like to talk about this is in terms of when do you wake up? Like if you wake up in the middle of the night at midnight, it means you probably had a really fatty meal because that's gallbladder channel. And your gallbladder is responsible for clearing all that fat out of your system. If you wake up between 1 and 3 a.m., that's liver, and that's about stress. Excess liver chi is about you feeling stressed out. On the other hand, if you wake up between 3 and 5 a.m., that's lung chi. Lung chi is about grief. That's about dreams and memory. And often we're grieving something. It may not be that we're grieving the loss of a loved one, could be that we're grieving the loss of a job or the loss of a relationship or a medical diagnosis that we got. But that 3 to 5 a.m. window is about lung. And they've done that for every different system in the body. I just find it fascinating that it seems to work. I work myself, my research is in people with Parkinson's, and we find that a lot of them are either waking up between 1 and 3 or 3 or 5 in the morning. And the medical diagnosis is that they make too little melatonin. People with Parkinson's make roughly 1/50,000th of the amount of melatonin that the average adult their age makes. Not 1/5, 1/50,000th. Hard to go to sleep. But if I talk to the people with Parkinson's about what's going on with them emotionally when they wake up in the morning, usually it's stress, which is liver chi, or it's grief about dying with Parkinson's, which is about their lung chi. So super interesting. Now, of course, what we all think about with Chinese medicine are acupuncture meridians. And so one of the things you learn within the Chinese medicine program is you learn the acupuncture meridians and all the different acupuncture points. The acupuncture channels are all laid out in Chinese medicine, and they have been well studied. What we don't understand still today is how they work. It's not a question of do they work, it's how they work. And that's a challenging thing. So at NUNM, we've been studying whether or not they're working based off of electrical pathways. So we actually have a lie detector that's been re-engineered, which measures electrodermal skin conductance. So how is your skin conducting electricity at every acupuncture point? And we can measure up to 40 points at a time. And what's interesting is that as chi flows through those channels, the electrodermal skin response changes. So it does appear to be measurable. It's just not measurable by a blood test, right? And it's a dynamic system. So it doesn't measure to a straight line. It measures to the Lorentz attractor, for those of you who understand complex mathematics. Now I'm going to teach you where one of your most important acupuncture points is today. This is stomach 36. So I'm going to encourage you to do this with me. You're going to take your right hand and grab your left knee. Okay, so you're going to the opposite knee, and then you're going just below your pinky finger, and touch that with your index finger of your left hand. That is stomach 36. If you want to change your digestion, like belching or nausea, vomiting, acid reflux, stomach cramps, you can grab stomach 36 and do acupressure. And it's suggested that you hold that point for 10 seconds, 3 times, and then 3 times a day. So morning, noon, and night. It also improves the immune system. It treats chills, fever, asthma. It alleviates depression. And with daily stimulation of this point, ancient lore in Chinese medicine is that you can live to be 100 years old. So you do your left knee, and then you do stomach 36 on your right knee. So grab with your left hand just below your right knee. You can see where it is here. And then grab that point just below your finger. And now I've taught you how to live to 100. What a valuable seminar this has been. If you learn nothing else, there it is. All right, why do I care about stomach 36? So I'm a researcher and I've led the global health program, and I've taken students to Tanzania for many, many years. One of the big issues in Tanzania is drug-resistant tuberculosis. What's happened is different countries have come in and they have brought antibiotics for tuberculosis. The average number of months that you need to treat tuberculosis with antibiotics is 6 months. But each of these groups only came in for 2 months and then they left. And when they left, people don't have access to those antibiotics anymore. And so the TB becomes resistant to that particular antibiotic because they didn't get a full course. And what you've wound up with is triple drug resistant tuberculosis in Tanzania. Acupuncturists Without Borders came in and look at the point they're on, stomach 36. They started treating triple drug resistant TB with moxa. So moxa is this, it's a form of incense made with artemisia, and artemisia burning at stomach 36. So you bring it right next to that point and get it really hot. You don't burn the skin. As soon as the patient says that's hot, you pull the moxa away, but you heat up stomach 36. Guess what? Treats triple drug resistant tuberculosis. I have no idea how this is working. Honestly, I do not understand the mechanism. What I do have is 30,000 patients who have been treated at this point, and their triple drug resistant TB is gone. So I can't explain it. In terms of our evidence base, we've got evidence it works, but no evidence for how it works or why it works. So that is an example of how Chinese medicine might work here. In addition to our naturopathic exploration days, we also have Chinese medicine exploration days. Our next one is May 23rd. And you get an introduction to Chinese medicine. You get to sit in on points classes or herbs classes. You get an acupuncture demonstration. We do tea ceremonies because a lot of Chinese medicine is delivered through tea, which is herbal medicine, right? Spearmint tea, antiviral. You also might get to experience some Qigong or Tai Chi, which are the exercises you do to move the Qi through the body. So, can you still apply to NUNM for next year? You sure can. Our deadline is May 30th. And if you need an extension, you just talk to Nicole, who's on this call, and she will help you with an extension. Remember that for naturopathic medicine, no MCAT, but we do have the same requirements as a conventional medical degree because it is a primary care physician that you are becoming. Our science GPA, we're looking at a 3.0 instead of a 3.4, so slightly lower, but not that much lower. We just recognize that a lot of our physicians need compassion more than they need the science. And in Chinese medicine, also no MCAT, you need a lot less prerequisites. So a Gen Chem, a Gen Bio, and a Psych, no organic chem, no labs. We teach physics in the program, so don't have to worry about any of that. But yes, you still have the ability to apply to our programs. And then if you're still looking at a conventional medical degree and you're one of those students who didn't get in the first time, keep in mind that there are still master's degrees that will make you more competitive. We have a School of Undergraduate and Graduate Studies Exploration Day, and it is online because our degrees can be online on May 16th. And I would encourage you, if you don't already, to follow NUNM on Facebook or Instagram. And now I'm going to open it up for questions.